Straight to our top story. New details emerging tonight on the first patient in the U.S. to be diagnosed with Ebola. Health officials have identified the man as Thomas Eric Duncan, and he is now in isolation at a Dallas hospital where his condition has been upgraded from critical to serious. And we've also learned that he may have come in contact with school children. Officials are now working to track down every person who may have come in contact with him. Thank you for joining us tonight. I'm Matt Templeman. Renee McCullough is off tonight. And now that Ebola is confirmed in the U.S., what are the chances of it reaching the Northwest and Oregon? KZI 9 News reporter Chanu Hurd joins us live in Eugene with a look at how local health officials and authorities are preparing. Chanu?
Well, Matt, like any disease or virus, health officials say Ebola could reach Lane County. But if it were to, local health officials and local hospitals say they're prepared for it. Ebola has claimed the lives of more than 3,000 people in West Africa. And now there's at least one case in the United States after a man traveling back from Liberia was diagnosed in Dallas, Texas. He's been hospitalized since Sunday. Local health departments say they have plans in place if it were to reach Lane County.
We've had tabletop exercises with local hospital consortiums, kind of talking to our local hospitals about, the communication. What do we do if?
Jason Davis with Lane County Public Health says although having Ebola reach Lane County is possible, it's not an issue to worry about.
Even if it did reach Eugene, it's a very, like I said before, it's a hard disease to spread. And I'm not saying that it's impossible. I'm just saying that it's not like the flu, for instance, or measles.
Lane County Public Health has also been working with global and national agencies and local healthcare providers to make sure they're prepared.
So I think every health department has really taken steps, and the CDC has really pushed out information on what do you need to be prepared.
University of Oregon biology professor Janice Weeks says although there aren't any local Ebola cases, it has had an effect in a program she heads, which would have sent 8 students to study abroad in Ghana this term.
We decided the prudent thing was to cancel the program because we were concerned about guaranteeing student safety.
Nationally and locally, health officials are prepared to deal with Ebola.
The bottom line here is that I have no doubt that we will control this importation or this case of Ebola so that it does not spread widely in this country.
Peace Health and McKinsey Willamette, they have plans in place and rooms identified. And then if we are looking at a bigger outbreak, we're talking hundreds of people, we have large spaces, such as a high school gym.
Public Health says local doctors have been prepared to ask the right questions and look for the right symptoms, and local health officials have gone through extensive training and many exercises. Live in Eugene, Chanu Hurd, KZI 9 News.